bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, the McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, and the Holland Bloorview Children's Rehabilitation Hospital Foundation. We would also like to thank the following Keystone partners for their ongoing contributions that support all of CAFC's programs and activities.
All right, hello everyone, and welcome to today's episode of CAFC Presents. My name's Doug Maynard, and I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And today's webinar is titled Practical Applications of #social media in Healthcare, the Good, the Bad, and the Ugly. This is actually our third and final installment in our three-part mini-series on social media. Back in October, we heard from Dr. Christine Chambers and Dr. Michelle Dyson, Christine from the IWK Health Centre in Dalhousie University and Michelle from University of Alberta, who brought us some of the latest research that's providing some insight as to the effectiveness of social media and translating knowledge to specific groups within healthcare, and that included getting evidence to clinicians as well as health information to parents. And then we had Christine come back with Erica M. from the Yummy Mummy Club to talk about the It Doesn't Have to Hurt campaign that has been a wildly successful campaign that's engaging a massive audience around the topic of children's pain. So now that we know a bit about what the research is telling us about social media and its effectiveness and specific target groups that it works well with and some that it doesn't work with, we're now going to hear from some people that are sort of more in the trenches of the hospitals, the research institutes, and other healthcare campaigns or health information campaigns, and they're going to share their practical experiences with using social media and hopefully give the audience a chance to sort of take all that stuff that we heard about what the research is telling us and maybe temper it with a bit of insight as to how this plays out in the real world through their experiences in using social media in the real world. So first, we've got three presenters today. First, we'll be hearing from Dr. Eric Benchimol. Eric is an assistant professor in the Department of Pediatrics and the School of Epidemiology, Public Health and Preventative Medicine at the University of Ottawa. He is also a pediatric gastroenterologist at the Children's Hospital of Eastern Ontario's IBD Centre. And they have a Twitter handle at CHIOIBD, if you want to follow them on Twitter. And Eric is also a scientist at the CHIO Research Institute and a scientist at the Institute for Clinical and Evaluative Sciences. Following Eric will be Ann Fuller, who's the Vice President of Volunteers, Communication and Information Resources at CHIO, the Children's Hospital of Eastern Ontario in Ottawa. And you may recall Anne coming to talk to us about social media quite a number of years ago at our conference, where social media was fairly new for the healthcare world back then, I think 5 or 6 years ago, whenever that was. So it'll be interesting to hear how things have changed over that time and how hospitals are using social media. And then we're going to be hearing from Rob McEwan. Rob is the Vice President at Argyle Communications, and Rob leads the health and wellness team at Argyle Communications in Toronto, and he's going to be talking to us about the national health care campaigns and how social media has been a big part in many of those campaigns. So without any further ado, I'm going to hand the virtual podium over to Dr. Eric Benchimol at the CHIO Research Institute in Ottawa. Over to you, Eric.
Thank you very much. I appreciate the opportunity to speak to everybody. Let me get my slides up for you right now. 1 second. So thank you very much. I'm a physician, a pediatric gastroenterologist at CHIO. I'm also a researcher, a clinician scientist. So 75% of my job is research, and I do epidemiology and health services research with large databases, large health databases. So my research is not at all related to social media, only in that I discovered that social media back in 2009 was a very good tool to help facilitate research, to help get the word out, to go beyond just the scientific publication for research and actually to get the word out to people who may be making decisions in terms of policymakers, but also in terms of the public, to help them understand that the research that they participate in is very important and makes a difference in the care of patients and the care of children. So I might provide a bit of a different perspective. I recognize that most of the people in the audience are not researchers or not physicians, although some of you may be out there. but some of you, judging by the lists of people who registered, were project coordinators or administrators that might be supporting researchers, and the researchers may not know that this is something that might be useful, or might ask you for support and help in getting a social media campaign or social media profile started. So hopefully you'll find that this presentation is useful both for you and for the researcher themselves. Happy to share my slides and happy to answer any questions at the end. So just to start off, since I am the first speaker, I know there's already been a couple of presentations on social media, but this is sort of what I consider the definition of social media, and it's really not all that exciting and not all that new. It's any tool that facilitates communication or collaboration between human beings. So clearly, before the information age and before computers, we had many such tools that facilitated collaboration and communication, and most of the time they were adopted by scientists and by physicians in order to facilitate the care of their patients and the research that they were providing. So it's really nothing exciting and nothing new. It's just the way in which we're engaging in social media has changed, and probably the opportunities to engage have expanded significantly in recent years. This is kind of my social media profile in general. So I'll go through a few of the things that I do as a researcher and a physician. So firstly, I use Twitter, and Twitter is my primary social media outlet for professional purposes. I have my own personal Twitter account at Eric Benchimol, which I tweet out. I kind of focus on anything related to pediatric healthcare, anything from general pediatrics to vaccination information to gastroenterology, pediatric gastroenterology, and also my specialty, inflammatory bowel disease, Crohn's and ulcerative colitis. And this is really aimed at the general public in order to get the word out and try to disseminate knowledge for pediatric healthcare. I also administer the CHIO IBD Center Twitter account, which is focused specifically on producing or disseminating new research in inflammatory bowel diseases to patients and to families, as well as to the general public. I actually started the IBD account back in 2009 with the hopes of, more collaboration and communication amongst IBD researchers and physicians and scientists, and I discovered in 2009 that there were no other IBD researchers or physicians or scientists. I was in fact only one of 2 pediatric gastroenterologists who were actively using Twitter, and there were very few adult gastroenterologists as well. So, it ended up being more of a public communication tool rather than a professional communication tool, and that's changed as time has gone on. So obviously, and you'll see in my future slides, Twitter has become a tool that scientists and physicians do use to communicate amongst each other as well. Facebook and Instagram I use for personal reasons, friends and family, just communicating and keeping up with people. However, again, as time has gone on, that's changed, and I think a lot of organizations, professional organizations, whether it be hospitals, research institutes, even journals, have recognized that the majority of the social media traffic really is on Facebook. And so they've really bolstered their activities and bolstered their own pages, the professional pages. So my feed now on Facebook has become much more integrated between personal and professional. But I don't allow, for example, I don't allow patients to follow me on Facebook. I don't send out anything related to professional aimed at the public. I really reserve what I post on Facebook for friends and family. LinkedIn, I've been a member for a long time, haven't found it of very much value in the scientific field, and that, again, that could change in the future, but for me, it really is basically a Rolodex of the people I've met and professional networking. I think if you're in industry, the pharmaceutical industry and other private industry, it's much, much more useful, and there's a lot more communication going on with LinkedIn. And so I feel like I still have to be part of it, but, I don't post very often on LinkedIn. ResearchGate and Google Scholar, we'll talk a little bit about in a bit, but these are online social media tools. I mean, ResearchGate is a better social platform, meaning you can communicate back and forth with scientists, and they act as sort of online CVs and summaries of publications, but also ways of communicating with other researchers in your field. I use Yelp and Foursquare really for recommendations when I'm traveling and things like that. And YouTube, I obviously use personally, but it's also a very good platform for education of patients and families. We have a CHEO IBD Center YouTube account with educational videos about IBD, all embedded on our CHEO IBD Center webpage. So, people can see the educational videos whenever they want, or they can subscribe to the CHEO IBD Center channel. And then CHEO, obviously, as a hospital, also has an excellent an excellent YouTube account that posts useful public information. So that's everything that I use. You notice that Google Plus is not listed there. I did use Google Plus. I think everybody has sort of gone away from that. And Pinterest, I haven't found much use for yet. We'll see how things go. So the criticisms of social media are here. So really, the growth of technology, some people feel that the technology is encroaching on every aspect of our life, and it has potentially damaging implications. That has yet to be proven, but it is happening. Privacy issues are very important, obviously, in healthcare. Social media is built on a culture of active personal and professional disclosure. There are concerns about how this is changing the interface between public and private spaces, and about the misuse of data. And in addition, privacy for researchers, putting your professional life online can feel exposing, particularly if you express opinions and ideas that have not been subject to the normal process of peer review. So so engaging in social media and building your profile can be uncomfortable for some researchers who are really, by nature, very private and methodologic people who think that everything should be peer reviewed. This is not what social media is. It really is about expressing opinion and disseminating knowledge. The banality of it, many social media tools are based on the exchange of small bits of information, and people feel that perhaps that's not the appropriate form that research should be taken. There's a loss of authoritative perspective, so anybody can have 10,000 followers on Twitter, and you might think that Jenny McCarthy has more impact than an expert physician in vaccination. However, I would argue that that's one of the reasons why we need to engage in social media, because I think we do, as physicians, we do have an impact, and we do hold a certain amount of weight. And if we're active and we're engaged with the population using social media, they will see our view as more authoritative and the evidence is more authoritative than a celebrity who's tweeting out about incorrect knowledge. The idea of information overload, so we all know we're all connected every minute of our lives, and so it's difficult to balance personal life, professional life, and activity in social media. And obviously we talked about the accuracy of some of this information and the fact that it's not published and not subject to peer review, all of which researchers are a bit uncomfortable with. However, I think this slide really says it all as to why researchers should be involved in social media. Even the largest scientific conference, you're lucky if you get 500 or 1,000 people in the room when you're presenting your research. A large semi-scientific journal has a circulation of 1 million people, and it, without a doubt, dropping, whereas Twitter, Facebook, and blogs can have a reach of up to 100 million people or more really now. So, this is an argument that if you want your research to reach the people who are the targets and who are the aims, whether that be patients, whether that be clinicians, whether that be policymakers, you really need to engage in the activity, otherwise you're missing a potential huge audience. So we're going to talk about a few things in my session. Firstly, I want to talk a little bit about recruitment, both collaborator and patient recruitment using social media, and give some examples. And then we'll talk about knowledge translation and knowledge dissemination using social media. So starting with collaborator recruitment, there was an excellent article published, I guess a year and a half now, in Nature about social media and the engagement of researchers and the opportunity to reach colleagues using social media. This is one example of a survey that was run of researchers. You can see here clearly that researchers are using now social media and are engaged and use it on a regular basis. This list may be different than the general public. It might not be the Facebook that they're using for their research purposes, but they are using sites like ResearchGate and LinkedIn and Twitter. And I think if you want to reach out to other people who may be knowledgeable in your field, or you want to build new collaborations, or you just want to disseminate your research and try to build the knowledge base, this is a very important outlet to do that with. And I think an excellent example was published last week in the New York Times when they discussed the team of scientists who are coming together to investigate the Zika virus that's going around in South and Central America. You know, one of the first things that one of the scientists who started this collaboration said was she really reached out via Twitter. She complained via Twitter that people were not collaborating enough, and people approached her. They read her tweets, approached her, and they developed a collaboration between 9 or 10 different centers who maybe would not have collaborated or in very geographically dispersed areas. And this all came from Dr. Vosshall, who issued a plea for constructive and detailed mosquito DNA mapping back in January, and that led to, you know, collaboration between researchers online. So a real opportunity, and I don't think this would have happened 7 years ago when I joined Twitter. I think we would have been tweeting into dead space because there were not the researchers online. That's changed completely recently. So moving on now to patient recruitment and how can we use social media for patient recruitment. Really, there's a few ways that you can use it. You can use it to collect health information. You can use it to identify and communicate with potential research subjects. And you can also use it for intervention purposes. So there have been interventions, public health interventions and other things that have been communicated to patients through social media, which have then been studied. One example of patient recruitment and collaboration and also collecting data on patients is this CCFA Partners. So this is from the Crohn's and Colitis Foundation of America, and they developed an online cohort of inflammatory bowel disease patients in North America, and there are Canadian centers now participating. They've, in only about 2-3 years, developed a cohort of 15,000 people who have signed up to say, I want to collaborate and participate in any research project that might suit my clinical disease, and I want to help improve the field and improve the clinical care of patients. And of the 15,000 members now, about 400 of them have, you know, fully updated social profiles and have really engaged in research. And there's about 225 different locations that are ongoing. And they've done everything from surveys of patients to see what foods bother them the most and what foods might flare up their symptoms to, and I'll talk a little bit about this, but they've actually started to do a pilot study of engaging patients in sending blood work, and so to develop DNA samples and to develop a biobank of these patients and be able to conduct research with their biologic specimens, all based on social media engagement. Another example is this research match, which I think has not yet expanded to Canada, but you can see it coming soon. And this is really like Tinder for researchers, right? So a researcher signs on and says, I want to conduct a study and recruit patients for X. And Research Match then identifies all the patients with the relevant disease who might meet the inclusion and exclusion criteria and sends the researcher a list of patients who they can then communicate through this portal in order to enroll patients, let's say in their geographic area or whatever. And I think this is extremely important in rare disease research where you may be conducting a study in a city like Ottawa with 1 million people, but the disease actually has a frequency of 1 in 1 million. You can imagine that if you can get people engaged and recruit people from across North America, this has huge opportunities for the future. A great example from Canada is the Hirschsprung's community. Actually, they started off with the name Shit Happens, because Hirschsprung disease is a disease where you don't poop properly, you're missing the nerves of your colon. And it really started, it's a very rare disease, and it started with the mother of a child with Hirschsprung disease who was frustrated that there was not enough information about what happened to these patients after their surgery. The surgery is supposed to fix the disease, and it does to a certain extent, but the surgery can also lead to longer-term complications, and these kids can get into problems with constipation and diarrhea and other things. So this mother in Winnipeg actually started this community online and started a blog. That was her first step about her frustrations with, you know, what's happening with her child and the healthcare system and the symptoms that they're having. This led to a Facebook page, which now has about 3,100 likes and a potential reach of 250,000 people. 260 Instagram followers and 200 followers on Twitter. And this, obviously, this whole endeavor has led to an almost instant Hirschsprung disease online community where the parents communicate with each other, they can discuss medical treatment, but also they've engaged researchers to try to do research in this field. I think one thing that's very noteworthy is that Facebook has a lot more likes than Twitter followers. So it's an indication, again, like I mentioned earlier, that really, I mean, if you're reaching out to patients, Twitter may not be enough. Facebook really is where most people spend their day. And, as a result of the Twitter followers, more recently she started an Instagram account, and that really has taken off as well, much quicker than Twitter has. So you got to tailor your social media campaign and your social media efforts to fit the audience that you're trying to reach. As far as research that's been done with that, one of the questions that was asked by a researcher in Winnipeg was, when was your child potty trained? And something that we didn't know about Hirschsprung disease after the surgery, because the surgery occurs in the neonatal period. And so the question was posted by mom, and within 5 hours she had 30 responses to the question. And within 2 days there were 415 views to the question. She was able to develop, a basic pie chart as to how quickly as to when these babies were potty trained. And in honest truth, in such a rare disease, it would take weeks or months to get such a quick response in real life, if you got it at all. And it would take an international study probably to get so many responses. So, it's a huge opportunity for research to tap into these communities and engage patients in their research. So there's lots of evidence like this about the effectiveness of using social media for research, but there's also lots of evidence and areas of concern. Things like the ethics of it, the research ethics. In the past, REBs were concerned about approaching patients on social media. I think the more progressive REBs have started to accept that the patients who are engaged in discussion of healthcare on social media are sort of giving consent to at least approach them and discuss. There's still question about whether we can use the data that we mine from social media to conduct research. But again, I think this is a growing field that REBs are addressing. Privacy issues, I think most people agree that if you're posting on social media, you've given up the right to privacy, at least to a certain extent, about what you're posting on social media. And it's a public forum and people tend to know that. And then the issue of selection bias is important. The people who are engaged and working on social media are not necessarily the typical patient, right? They might be more highly educated, they might be of higher socioeconomic status, and so we need to be careful about the methodologic considerations when we're doing research using social media samples like this. Moving on to knowledge translation and knowledge dissemination, it's important to know what CIHR defines as knowledge translation, because CIHR has really put an emphasis on knowledge translation. It's no longer enough to conduct research in a vacuum. You need to take your research and you need to take it to the next step. So if you're a bench researcher, you need to disseminate that research and see how it applies clinically, or how it can be taken to the next step to other bench researchers in order to make the science move forward. You don't just stop at your own scientific publication. And I think social media is very important when it comes to knowledge translation because of some experiences that we've had in Canada recently. I don't know how many people have read this, but if you're aware of the Zamboni procedure, which is a vascular procedure in which the neck vasculature was dilated in order as a possible treatment for multiple sclerosis. Okay, so that was called the Zamboni procedure after a surgeon in Italy named Zamboni who did this procedure on a few patients, found that they got better, and published a case series essentially, and then was very effective in knowledge dissemination and got picked up by many media outlets and got picked up by social media. And it sort of became a bit out of control, I would say, and I think most people in Canada now would agree. So you had the sort of initial publication around this time period in late 2012 with the initial Canadian media reports, and all the media around the world did report on this to a certain extent. W5 covered it in Canada, and for the most part, things sort of dropped off in other countries. The interest dropped off. However, in Canada and Italy, things got disseminated through social media. In less than 2 years, there was more than 500 Facebook groups and events promoting this vascular therapy for MS, and there was unprecedented pressure on politicians and funders to alter research priorities in order to investigate this as a possible treatment for MS. So later in 2012, the MS Society had a public meeting to investigate the possibility, and by August 2012, August 2010, that's less than a year after the initial publication, CIHR convened an expert panel and decided to fund rapidly a number of studies that would look at this vascular therapy, the Zamboni procedure for MS. So really that was because of public pressure, and much of it was born from social media. Now we follow up now, we know that this procedure is completely ineffective for the treatment of multiple sclerosis. The studies that have come out have all been negative. And so it's kind of a negative, right? So the public pressure resulted in funds being provided to research that really was not based in any sort of basic science. It was based on case series. And that resulted in wasted funds and unfortunately some patient deaths as well, because the procedure is not without its risks. So my argument is that patients are engaging in this type of social media and are putting pressure on professional societies, on funders, on CIHR, and on policymakers. And if we as researchers and physicians do not engage in the discussion, we're going to get left behind. And that will result in things getting funded that perhaps are not based in science. So it's important for us to engage in the discussion and engage in social media as well. So whereas scientists use reports and briefing notes and press releases, news conferences even, to disseminate their research, patients are really engaged in social media discussion, and that's their outlet for finding out what's new and what's going on and putting pressure. And so we've gone from an era where science is you conduct a research study because there's clinical equipoise. We don't know the answer. We don't know what clinical treatment is best. Have we now gone to the days of Facebook equipoise where social media is going to guide what research studies we should be doing? And one example of this is, again, the CCFA partners site. There is an area where the patients will post and vote on their most important research questions. So what questions are they most interested in seeing the answers to? And those votes are going to decide how CCFA, which is one of the largest international research funding agencies for IBD, they're going to decide how CCFA funds studies. And that's good and it's bad. I think it's the reality is that it's there, and we need to pay attention, we need to engage, and we need to discuss with families so that they, on social media, so that they know, what we feel and how we feel the science is going. So the bottom line that I tried to get across in this short talk is that social media is here to stay. It's not going anywhere clearly. It may not be Facebook in 10 years. It might be some other site, but the social media in different ways is here to stay. It's changing how we collaborate, so it's making collaboration and international communication much easier, which is probably good. It's being used to recruit patients, which I think has its pluses and minuses, but it's probably good as well. And it's influencing science, and whether we like it or not, it's influencing the funders of science and the policymakers, and there's really no choice in the matter. And if we don't engage, if we don't develop a strategy as researchers, as clinicians, we're going to be left behind, and we're no longer going to have a seat at the table in deciding what gets funded for research. So these are a couple of excellent references aimed really at scientists and researchers who want to use social media and engage in social media. I urge you to read those, and I can provide them. We can put them in the resource page for the presentation. Thank you very much.
All right, thank you for a great presentation. Really covered a lot of ground there, lots of background to work with there, and thanks for mentioning that Hirschsprung's program. As we did a presentation on that about a year ago on this webinar series. It's on the Knowledge Exchange Network if anyone wants to take a look at it, and it is titled "Shit Happens." It was the title of that campaign, but it was really interesting and brought a lot of the things that Dr. Benchimol sort of mentioned from the family perspective and gathering a group of people from around the world to talk about a rare disorder like that. So we did have a question come in, so this is my chance to remind the audience, type your questions in as you think of them. So just before we move on to Ann Fuller at CHIO, we'll take this one question. The question was asking, so as a physician, do you recommend or have any thoughts about patients opening up their personal histories on the internet? And I did seek some clarification here. So they're talking about the patient sharing their information in a way that maybe it's an attempt to be anonymous, maybe it's from a personal Facebook account, but that concept of sharing patient histories, such as maybe on Patients Like Me, where there may be some public exposure of their disorder, and maybe the patient is comfortable with that, and maybe not. Maybe they end up getting identified inadvertently. But do you have any thoughts as from the physician perspective on, or have you ever recommended a patient participate in that?
So, fix my mic here. Sorry. So, I think it's a reality. I think it's happening. It happened in the past as well, but it was more, patient support groups is exactly that, right? So it would be 6 or 10 people who got in a room together and discussed their experiences with their disease, with their chronic disease, for example. I think these patient support groups have expanded and have become more prominent on social media. So, patients with any sort of chronic disease, they need to know that they're not alone, and I think that's very important, especially for children and adolescents who I treat. It's important for them to understand that they're not alone and that people are going through the exact same thing that they are, and I think that does help support patients, but they need to be aware of the risks, and they need to be aware of the privacy concerns. They need to understand that anything they post on the internet, even though they think is private, could be public at any minute. And Facebook obviously had many problems in the past with changing privacy settings with updates. So suddenly something that was private becomes public. They've become much better at that, and the privacy settings are much more granular. But they need to be aware that nothing is truly anonymous on the internet, and if somebody wanted to get a hold of that information, they will. Obviously, the big concern is always that an insurance company will get a hold of that information and decline insurance, or use it against you, or some other organization will use it against you. We don't yet have a practical example of that happening. However, that's the concern that privacy advocates have. I think the reality is that it's happening, and I think it's probably a positive thing. Certainly for us, at CHEO IBD Center, we have learned that the face-to-face sort of support groups that we used to have for adolescents, the teenagers are much less willing to attend those. They're much, much more interested in online communication, and the parents are as well. So we've had multiple requests to start sort of support groups for patients with IBD online, whether it be a private Facebook group or whatever it is. Now, I think there's, we have some concerns with that and taking on that role in terms of the privacy impact, but there are great groups like Crohn's and Colitis Canada, for example, who do have online communities to support patients that they sign in for and register for, and it's not anonymous. So, I think it really is a matter of education of the patients and the families and making sure that they understand the pluses and minuses.
All right, thank you. And as always in the pediatric community, there's that extra burden of ensuring that a youth or a teenager really understands those potential implications of sharing this information. But all right, so we don't have any more questions for now. But if you do have any more questions for Eric, please do type them in, and we'll certainly get to them at the end. But for now, we're going to move not too much farther, just to the next building over in Ottawa, here over to the Children's Hospital of Eastern Ontario with Anne Fuller. So over to you, Anne.
All right, thanks, Doug. So you've just heard a physician's perspective, and after I speak, you'll hear from Rob, who's going to give you some kind of really great best case scenarios of what you can, and maybe some great ugly scenarios. What I'm going to give you is a pragmatic perspective of a mid-sized hospital with modest resources for social media. And as Doug mentioned, I presented about 6 years ago at a CAFC conference. And back then I took you guys through the kind of very simple pragmatic approach we're taking to social media at the hospital, basically a 7-point kind of philosophical approach to it. And we were using a 3-phase approach to it, so foundation building, pilot programs, and expansion. And I would say now that foundation period is kind of, it's all solid, it's there, the basics are in place. We have our social media policy, we have a common assessment tool to help us determine how to respond to comments. We have a decent community that started to be built, so about 20 to 25,000 fans or followers on Twitter and Facebook, and about 10 departments or programs at the hospital, like Eric just mentioned, with CHEO IBD, who have embraced social media and have department accounts as well to speak to those specific communities. And our CEO is very active on social media. And we have really nailed how we're going to work with our foundation to have one account for both the hospital and the foundation and support the foundation's needs. So those basics are in place. And now what we're looking to do is that phase 2, which is really looking at pilot programs. And as a perspective, we set for ourselves a little bit of a vision for how we want to use social media at the hospital. Basically, we said that, making sure we take the right precautions, we can use social media in a really positive way to extend the reach of our expertise outside of our walls, so outside of the number of kids and their parents who we can see physically in the hospital every year. So we have an opportunity of doing that with social media, and as Eric said, maybe even sometimes a responsibility to do it. So with that in mind, we're now going into phase 2, where we're kind of looking a little bit more about pilot program projects to use social media in a different way outside of the standard reaching out to people and posting hospital news and events and patient stories. So I'm going to give you a couple of really simple examples of some work underway. So one is looking at a problem that the emergency department was experiencing. So the number of visits to emergency department has been rising every year, reaching 70,000, 77,000 visits a year. And the emergency department physicians were starting to get a bit worried. They're worried because it wasn't just the visits that were going up, but the number of low acuity visits in particular was also on the increase. So about 40 to 60% of the visits to emergency are low acuity visits, so things that could be dealt with at home fairly simply with the right treatments and precautions. And what the physicians were worried about is that with so many more kids coming through and not having exponentially more resources to support that, how would they make sure that they don't miss anything? So they came to us and they asked us if we could work with them to figure out how to get the message out about when it's appropriate to come to emergency and when it's not appropriate to come to emergency. And the result is a campaign called Choose Wisely. It was a pilot program launched last year, and it basically uses traditional and social media, but it started with a physician interaction. So we developed with them this pamphlet, which basically takes a look at, when should you come to emergency, and then what happens is that after the patient goes through the emergency department, gets triaged, sees the doctor, finds out what's going on, or has that sense of relief, okay, that my child is fine, nothing's going on. So after the stress of the emergency is done, then the physician would take this pamphlet and give it to the family of a low acuity patient and say, just so you know, here's the different, here's the scale for different visits to emergency department, and here's where your case was on this scale. And in your case, we're happy to tell you that everything's fine with your child, everything's good. In your case, you might have been able to see a family doctor or provide the other options as part of an education campaign. So what we did is we launched this with traditional means, so a press release. We also launched it with a live Q&A on Facebook with one of the physicians from the emergency department who would basically answer questions on Facebook and provide some perspectives on when you might come to emergency and when you wouldn't. And then we did a series of tweets and a Facebook posts about the campaign. And here is one example. So in this case, we basically reposted an Ottawa Citizen story on the campaign, and we're encouraging people to check out the checklist on how to know if you should go to emergency or not. So this one post reached about, you can see in the bottom left-hand corner, 25,000 people organically, generated, I think this one generated about 30 different comments. And you can see some of the comments in the right there in that box. Those are examples of some of the things that people said. And it wasn't just our social media, though. It also ended up getting driven into other social media. So Shea 106, for instance, is a local radio station. They posted on their Facebook page something about our program, and their Facebook post ended up with 99 different replies to that Facebook post and a lot of back and forth dialogue. So we actually just found this accidentally. Well, not really accidentally. We were doing a search on CHEO, as we do every week, to see what conversation is going on Facebook outside of our page but about us. And overall, if we take a look at the campaign, I'd say there's some good and some bad, probably no ugly in this one. The good is that we got the word out there. Now, there was, after this campaign, a decline in emergency room visits, but it would be way premature to say that this campaign influenced that. There could have been other factors influencing it as well, and the emergency department is looking at that. The good was also there was some good constructive debate in it. So there were people who weren't happy with this, but there was people going back and forth and arguing on our behalf about why it makes sense for the community to take these extra precautions and not for CHEO to be the kind of default to go to. And we got that support from the community, so a lot of people were stepping in and saying how they thought this made sense. The bad of this is, of course, that it became a vehicle for parents to share some of their negative experiences. So I'm sure every hospital has experiences with social media comments from parents who are waiting too long in emergency, because let's face it, when you have a sick child, you want to get through quickly and it feels like an eternity. So it became a vehicle for some of those stories, and also for some stories when families went home and then later had to come back because their child grew more sick. And so that criticism was in there. And what we would do was, of course, respond to those criticisms as best we could. And overall, I'd say that the amount of those types of comments didn't negate the overall value of the program. So it's certainly something that we consider doing again. In the end, the pilot was put on hold because of the fact that summer came and emergency rooms are not as busy in the summer. And also, some physicians were a little bit uncomfortable in delivering that pamphlet, but the emergency department is looking at it more formally, and that might be an opportunity down the road for a different CAFC webinar. If I give you a second example of something that we're working on, kids were waiting for a year for a referral to neurology to discuss tic disorder and Tourette syndrome. And Dr. Doja came to us and said that he wanted to create a video to specifically discuss Tourette syndrome and tic disorder and diagnosis and treatment and what to expect. And he did it because he had this premise that he could reduce wait times by having the physicians direct their patients and their families to this video instead of making a formal referral. See, what happens most of the time, he said, is that when he sees patients with Tourette's, they've had to wait a year to come and see him. And when they get there, he provides reassurance about, what's happening and how kids will grow out of it and things like that. But that's really all he can do at that stage. So in other words, they wait a year to hear him say something that could be made available in advance on YouTube. So we created this video with him, and what the department is doing now is that when they get a referral for tics, they send an information sheet to that physician and ask them to have their patients watch this video. And then after watching the video, if they would still like to see Dr. Doja, then they resend in the consultation, and then they'll go into the queue for a regular clinic appointment. So this has been going on for about 6 months so far. And again, we don't have formal findings yet, but just an anecdotal response from Dr. Doja is that so far they've had no consult or referral request resent after watching the video. So in other words, the video is effective. It is providing those families with the information they're looking for, and they do not need to ask for the referral again afterwards. And they've also had anecdotal good feedback from patients and families who have seen the video. So when that pilot is complete, that one might also make a good case study on a different CAFC webinar on strategies to reduce wait lists, because it is a really interesting, very practical solution or practical application of YouTube in a hospital setting. It's not just physicians at CHEO that are experimenting this way, also nurses. So Dr. Denise Harrison, for instance, is doing a study, or has been working on a study for some time, about the use of YouTube to change how families and physicians manage pain in infants who are getting shots and vaccines, etc. And so this is an example of one of her videos that has almost 15,000 views now. So then moving in a different direction, another thing that we look at doing as part of our phase 2 is contributing to broader public dialogue. So not necessarily just hospital news and good news stories and things like that, but getting in there into the discussions that need to happen. So we were approached by some physicians who were getting pretty discouraged by the fact that they would have kids coming in admitted to the hospital for long periods of time, quite ill, from diseases that could have been prevented by a vaccine. And they felt they wanted to, as one physician put it, rise to their responsibility to get the facts out there. That line actually came from our very passionate Dr. Lindy Sampson, who's our new chief of staff. And she came to us saying, what can we do? Like, what role can we play? How can we be more vocal out there to combat some of the Jenny McCarthy's, as Eric just talked about? So we created a microsite called Spread Facts not infection. And then we launched a series of Facebook posts and tweets, etc. on the subject. So vaccines, as I'm sure you've all experienced when you do your annual time to get your flu shot Facebook post, is very hot topic. So here's an example of one post that we did. So this one reached about 28,000 people. I've included the analytics there for you, and got about 2,000 likes, comments, and shares just organically. And as you might imagine, it generates a lot of dialogue. So here's a sampling of some of the responses that we received to that one post. Now, again, I'll say that there's good and bad, no ugly here. The good is that we were able to dispel some myths. So we had in advance prepared stock answers to the criticisms we expected to get on Facebook and Twitter. And so whenever we saw one, we just pop in the stock answer. You can see some examples of that on the right. And as you would expect, there was a lot of commentary from the anti-vaxxers. But it was interesting to see that we didn't really need to take them on in great force because the community was responding to that. There was, for every passionate anti-vaxxer, almost an equal number of passionate pro-vaxxers who wanted to get out there and help dispel the myth. The bad, I'd say, with this one is that the anti-vax movement is just better at social media than the pro-vaccine, and their use of social media is often more dramatic, so it gets more traction. However, I did think that this little case study was interesting because this is a woman with 7 children, and she was an anti-vaxxer. She's a blogger and shares her stories of raising her 7 kids. And her kids ended up getting whooping cough. And so she changed her stance and became pro-vaccine and came out in a blog post explaining why. And this, her blog post went viral, and it got international attention, certainly a lot of coverage, social media in Canada and the United States about it. And it's just interesting that, we had taken the time to do a formal campaign with a, little microsite and scheduled posts and making sure we had commentary ready. But this one blog post that she wrote ended up generating much more discussion, probably because it was emotional, it was more organic, and it was a really good story to it, a story about people. And that was probably the most effective pro-vaccine social media that I've seen in the last little while, so I wanted to include that example as well. And changing directions, or maybe just expanding from that, is the broader role in health education. So like many hospitals, we partner a lot with our local public health. And we, in the last year, developed a more formal relationship with Ottawa Public Health, which has really been helpful. So we had found over the years that we would often come out with these things, like that vaccine campaign I just showed you, at about the same time as Ottawa Public Health coming out with something, and we weren't doing a very good job of integrating those two things together so that we had one message, that we were making sure that we were not almost competing with each other in terms of timing. So we developed a formal partnership. We were sharing our 2 biggest opportunities for health education, if you will. So CHEO has a 20-week series with CTV where we have a one story every Wednesday on a health topic of our choice for 20 weeks called Healthy Kids. And Ottawa Public Health has a website and a Facebook page called Parenting in Ottawa that was really well received by the public. So we created a formal partnership in which we'd share these 2 venues. And in doing that, for instance, on the Facebook page for Parenting in Ottawa, we have guests posts and guest live Facebook chats with CHEO physicians and other CHEO health experts. So here's a couple of examples. One is with Catherine Pound, who's a general pediatrician, and one is with Dr. Ritchie, who's a psychologist, and they did live Facebook chats answering questions live and putting guest posts on different days. It's interesting because we tried a few different ways of having those kind of live interactions with physicians. We've done a couple of live tweet chats now. We've had physicians who participated in live chats. Dr. Benchimol did with Yummy Mummy, some who did a live chat with Globe and Mail. So we've tried a couple of different vehicles, and I'd say that it's very low resource to do something like this on Facebook with Ottawa Public Health, and it's good because they have an existing audience and regular live interactions like this because they have an RN who basically provides answers live throughout the week. And it's low resource. You can do it fairly simply. It doesn't take up that much time, but also because it doesn't have that very strong established following, like a Yummy Mummy or like a Globe and Mail, it doesn't tend to generate a ton of response. So these ones, for instance, I think they got about, I think Dr. Ritchie got about maybe 18 questions. I forget how many Dr. Pound. So a good level of interaction, but not a ton. And here is one more example. This is an app that was created. MindMasters 2 is basically provides these little videos that teachers and parents can use to help build resiliency in younger kids. So basically trying to build positive mental health. And so it has a series of little videos. For instance, one's called Spaghetti Toes, where you're teaching kids different techniques for relaxation and things like that. So it was originally created as a tool for teachers, and then they decided to create an app for it to complement the videos on YouTube, because it would be easier for teachers to use it in a classroom with their smart boards, and for people to be able to access it more quickly. So this was launched about 7 weeks ago, and in the 7 weeks, the webpage has 13,000 views, and we've had so far 500 downloads of the app, which isn't huge, but it's early and we haven't done a ton of promotion on it yet, but we've been getting good feedback on it. So those are some kind of practical examples of our growing in social media. I was going to, before I left, provide a couple of examples of you know, the good, the bad, and the ugly. And so there's definitely trolls out there on social media, and we've certainly had our experiences with them. Now, I was going to provide some specific examples, but given that this will be available on the website publicly afterwards, I'm a little uncomfortable providing too many specific details because of the fact that I don't want to reignite any of the trolls. But our experience with them is that over time, it does go away. And I'd say that's reinforced by a more interesting and specific story. You know, when we were talking about this webinar, the good, the bad, and the ugly, and we talked about what are examples of the ugly, there was one story that came to mind to me more than any other. And it's a story of baby Joseph and London Health Sciences. So I called up London Health Sciences, and Kathy Cooley gave me permission to share a little bit about their story with you because it was so public, because it's documented. You know, they've done reviews of it afterwards and shared some of their findings. So she was kind enough to let me share a couple of details with you. So I don't know if you guys are familiar with this, but it was back in 2011. And what happened is that the parents of baby Joseph was a baby with born with a degenerative disease. And this story drew international attention because of a lengthy right-to-life case, as it was basically positioned. While baby Joseph was in the hospital in London, he breathed with the help of a machine, and he got food through a feeding tube in his abdominal wall. And the London Health Sciences clinicians were uncomfortable performing a tracheotomy after the baby's condition deteriorated so much because they felt that it was medically unnecessary. Now, the family took legal action against the hospital, so that wanting the baby to receive the operation, and there was a court battle. But what ended up happening was a very big social media uprising, the kind that every person, you know, looking at social media for an organization really gets worried about, because it ignited an international response. Right to life is a topic that people are very passionate about on social media. And what Kathy shared was that the biggest challenge for them during this time was that back in 2011, London Health Sciences was not on social media at the time. So she had some takeaways that she shared with me. The number one is that if you're not on social media, you don't have a chance to get your message out. And that is absolutely what they experienced. Number two, that you can't focus too much on the noise, right? You have to focus on the bigger picture. Sometimes there will be that noise, and you can't focus too much on about it, but the more important issue was supporting that family and supporting those clinicians. The third one is that people will come to your defense. So while there was a lot of very dramatic activity on social media, the tone shifted over time, and the community really came to their support and were helping to reinforce why the clinicians were making the decisions they were making. Number four, that those situations will pass. So even though that was one of the most heated social media things I've seen in the last 5 or 10 years, it did pass. And number 5, I think that, and this isn't something that Kathy shared, but my takeaway from our conversation was that they have a strong team of clinicians and communicators who weathered that storm very well. They had lots of proactive, positive activities to kind of manage that difficult time. And in the end, they probably got into social media faster than they would have otherwise, but that was a team that went through a really tough situation on social media and in the public eye and did a really good job. So those are my examples for you today, and Doug, I'll turn it back over to you.
And a great example at the end. There's certainly one of the things that most of our members in CAFC that's certainly one of the common fears when they start dabbling in social media, is that exactly that kind of very public scenario might happen. So that I really thanks for bringing that one out, and hopefully there'll be some comments and conversation as people are thinking more about this. We do have a couple of questions, but I think we're going to move on to Rob before we take the questions. We'll just get all the questions in at the end, because they're more broad sort of discussions that I think would be great if everyone was participating in the discussion that these questions will start. So we're going to move down the 401 to Toronto with Rob McEwan at Argyle Communications. Over to you, Rob.
Thank you so much. My name is Rob McEwan, and I am Vice President at Argyle Public Relationships. I focus on healthcare communications, and I have been doing so for over 15 years, which means that I've been working in healthcare communications when there was no social media. I have been working when it was adapted and started to roll out, where it experienced good, bad, and ugly scenarios, and now to its current state where it is absolutely mandatory to include in any type of communications efforts. My clients include pharmaceutical companies, natural health products, over-the-counter consumer products. I also work with hospitals, physician associations, and patient advocacy groups. I thought that I would talk about the importance of defining parameters when discussing social media. I thought that I would talk about some very specific examples that highlight good, bad, and ugly examples of social media communications in health from my perspective, and then, of course, open it up to question and answer. The internet is good, absolutely. It is an incredible opportunity to communicate with a mass audience. It is also an incredible opportunity to target and engage a very specific audience in a very cost-effective manner. North America is a highly wired society. Canada has one of the highest internet penetration rates in the world. It's estimated that nearly 8 out of 10 Canadians are online, and the vast majority of these users are using various social channels. So we are a very quick adopter of different platforms, providing ample opportunities to engage us in multiple manners. Mobile in Canada is growing. It's not been as fast as the uptake as in other markets, probably because of the costs associated with mobile access and internet use, but that is growing, and now we are seeing in many different populations that mobile use is actually surpassing desktop, and tablet use is actually starting to, in some groups, make inroads that is overcoming desktop as well. Also, just in terms of an opportunity, it was estimated that last year in Canada, e-commerce sales surpassed $30 billion. This is expected only to grow, and so the internet is also a vital means to engage and conduct business. Also, there's plenty of case studies that show for hospital foundations, it is an incredible cost-effective way to raise funds with different populations. What I think, though, is important is to define what your goals are associated with online communication efforts. I always encourage a dialogue to ask exactly what you want to communicate, what your objective is, and what you want to accomplish. And I think that it's important that those are revisited and reviewed frequently. Often people want to, just launch a Twitter account, or organizations as well as individuals. They want to be on Facebook. And so, again, just appreciating the opportunity that it provides, that's understandable, but we should be asking why you are on these platforms and what you want and hope to communicate. Because far too often, far too many organizations that I've worked with, they launch either a disease awareness website and they invest a lot of resources to get that site up and running, and then it's just left because of a number of reasons. And so I think that it is important to ask what and why we are hoping to accomplish with any type of online communication effort. I also think it's important to ask what in terms of the audience that we are trying to engage. There is one of the greatest things about the internet is that everything is measurable, that there is analytics and information about any group, any audience that you're trying to engage, and so we should use that information, we should analyze it, and we should understand who and where it is best to engage our audience. And by doing so, you're going to be that much more effective and your efforts are going to resonate. I pulled up everyone from a consumer aspect is focused on the millennials, and so I just showed in the slide some examples of millennials understandably being early adopters and drivers of smartphones, that they use their smartphones over desktops and or tablets to consume information. And so that's a great insight for you if you're trying to communicate this group to understand how to communicate with them. Same thing with parents. If you're a children's hospital and you're trying to engage a mommy or a parent's audience, there's different information, different platforms that resonate with this group. Seniors, what have you. So I think it's important to really, before doing any type of communication effort, to always ask and define what your goals are so that you can have a better understanding of how to reach them. Journalists use the 5 Ws when they're drafting any type of story, and so I also think that this is important to use when you're actually considering a social media communication strategy. It's always vital to first and foremost ask who is your primary and secondary audience, and defining who those people are that you want to engage. Content, as Anne referenced, just talking about some the benefits that anti-vacciners have online. Their content is always so passionate. It is always so personal. It's often, it is based on anecdotal experiences, but it resonates. And so content has to be essential in terms of what you want to communicate and getting that information out there. The platform, as I also identified and that research provides, different platforms resonate with different audiences. So don't just use Facebook, don't just use Instagram, don't just use Twitter. There's a variety of different social channels that resonate with different groups, and so you should be using a platform that is going to be most well received by your core consumer. Timing and engagement are really essential, and in fact, I think that more and more discussions that I'm having with my clients, it's not necessarily the number of likes and or the number of follows that you should be focused on, and I think that this is a general industry perspective. It really does come down to engagement and make sure that you are effectively communicating with the primary and secondary audiences that you are engaging. And last, I do think that it is essential that we should always be asking ourselves why we are doing this communications initiative, why we are using social media, and not just at launch, but check in and review and use those analytics and constantly ask why you're doing something to make sure that you evaluate its effectiveness. Some very specific examples of what I think are good examples in social media. The Princess Margaret Hospital did a live Twitter scope last month. You can see the details, March 10th of 2016 at 3:30. They offered a live streaming of their new GTX operating room. And what I think is really effective about this effort is that this was put on by their foundation, and so it was a means for them to celebrate and increase awareness of where donor dollars have supported the hospital. They showcased some of their experts. They were also, while the Periscope offering was being used through their Twitter following, they could see an increase over 1 hour of over 300 followers. So very cost-effective means of engaging and growing their online audience and showcasing their experience and excellence within a very specific area. This is an example of a microsite, a disease awareness campaign that Novartis Canada launched last year. This is for a very specific disease called CIU, or chronic idiopathic urticaria. It's essentially chronic hives. They're people, 1%. It's estimated 1% of Canadians have chronic hives that it's an autoimmune disease. There is no trigger. It is something that is just brought on and can last for several weeks at a time. This is a small group. There are no patient advocacy groups currently that are established. There is limited resources, limited information. So Novartis Canada identified that there was a need to communicate directly with this group and created a website that was collaborated with these specific patients, offering them a platform to really share and describe what their experience, what their chronic hives means to them, and it was just really well received. And what I think was best was that it was just very targeted. All the information was developed in collaboration with people living with this chronic skin disease, and the information was then shared and engaged with people that have the condition. Very, very targeted. The Phoenix Children's Hospital has this really incredible app that they've developed that actually helps parents choose the right car seat. And I know personally, as a new parent, I went into Toys R Us and I stood in front of a wall that was floor to ceiling in car seats, and I was looking at which one to choose, and I ended up choosing one that actually had this kind of cool cow-shaped pattern, over the seat cover, just because I thought it looked good, and I was just overwhelmed. Clearly, that is not what responsible parenting should be, and this app allows parents to just very quickly and efficiently enter, a couple of very specific points related to height, weight, and special needs that your child might have, and then they give you a recommendation and guide you as to what you should be looking for in a car seat. What I think is really great about this also is that it really showcases Phoenix Children's Hospital experience and commitment to children's care needs, but it also kind of got them out of direct healthcare information, and it kind of broaden their reach, and it allowed them to showcase an area that obviously that they have a vested interest in, but that was not really directly linked to services that they provide in the hospital. This is actually, this type of application is defined in social media as utility. It is a term that Jay Baer, who is a social media guru, has developed, and if you can provide useful information, that is why people are going to come back and engage you. And this certainly is a useful app that people will directly use, and then they will share and promote to others. And so it's a great example of creating something that is very efficient, but very niched, very tailored, and serves a very specific online purpose. We work with a brand called CeraVe. They are a line of moisturizers and skincare products, and we actually did some research that identified that dermatologists, there is an extensive wait time associated with accessing a dermatologist in every single province and every single territory in our country. So what we do is offer access to a dermatologist once a month. We've created a monthly chat on Twitter that is called Derm Wednesdays. The chat always happens on a Wednesday. It's always at 8 p.m. Eastern Standard Time, and it is always featuring Dr. Ben Barankin, who's a practicing dermatologist in Toronto, and Dr. Barankin makes himself available to answer any and all questions related to skin topics. We do identify themes, but really the point is to allow consumers to engage a skincare expert and ask them information and get access to this expert that typically they would not have clearly direct access to. The Humber River Hospital went through a move Q4 of last year. I guess the exact date is referenced here, October 18, 2015. The hospital had an extensive communications plan to ensure that as they shut down 3 of their sites and opened a new location, that it was communicated to various publics that they were doing this. But what I actually really like and applaud is that they came up with a theme associated with the move on their social media accounts. And they implemented this first. And so on their Twitter accounts and on Facebook, they used firsts, whether it's the first ambulances, as you can see, pulling out and or into the hospital, the first baby that was born in the new facility, first blood services, first operation that was performed. And I really like that and I applaud that they identify a theme for the day that really resonated and allowed them to extend the reach of their messaging and engage the public in a very powerful and personal manner. I'm now going to just outline some examples of what I think are bad social media and or social communication efforts. Both Dr. Fuller and Dr. Benchimol talked already about this, about privacy. And privacy really is an enormous issue. I think that it is something that we are actually just going to have to go through, that it is a process, and that there will be ugly and have been ugly situations, that there are bad situations, and then we'll get to good. But I think that that one of the biggest challenges that is associated with social media is that people are eager to share everything and anything, that privacy and privilege is really being compromised, and that as we have to remind, I think, everyone that whatever you're putting out on social media, it is there, and there's going to be a record of it, and it's always going to be accessible. The other is, and again, my peers or colleagues before me referenced, sorry, not colleagues, but presenters before me referenced, is the fact that as healthcare professionals, there is this privacy issue that you're going to have to manage as you are putting yourself out there and making yourself available and accessible online. You are opening yourself up to obviously access and questions from the public, from patients. And so again, this is a process, and I think everyone is going to have to find their own comfort level and identify different processes that they want to put in place to manage this. But it is a real serious issue, and one that we've obviously seen some very negative situations results. This, you might have heard of this really unfortunate and sad situation that happened last month at a hospital in eastern Ontario. A woman brought her child in and was unfortunately misdiagnosed. Now, the reason I actually reference this as because this is a horrendous situation, and this mother and another mother actually created a Facebook page that resulted in more commentary and identifying more issues that were associated with care. It also resulted in the media giving it some attention, but the hospital has subsequently announced that they're going to be doing a working group and focusing more on identifying the needs of managing and addressing with patient issues much more transparently and much more clearly. But why I'm referencing this as a bad is that this situation could very earnestly scare people, scare healthcare professionals, scare hospitals, scare researchers in making themselves available and using social media. And so that's why I think that this is a bad situation, because it would be really unfortunate and regrettable if situations like this resulted in organizations stopping their communication efforts and or halting it and identifying this as a risk. I've had many a conversation with organizations who actually do cite that they are nervous about using social media because they don't want to open themselves up to potential negative commentary for their consumers. And many, in response to that, and this is a discussion that I think is warranted and welcomed by many. If you are worried that your service or your product or your research is going to be criticized by the public on social media, then that's really not your primary concern. It shouldn't be your biggest concern. You should be looking at the service that you're providing. You should be looking at your product and making sure that it holds up to scrutiny, and that you are providing useful, valuable offerings that the public wants and or needs. So some examples of the ugly. I think that the biggest issue and some of the most unfortunate situations on social media come down to misinformation. So, and also, again, my earlier presenters spoke to this, and I do believe that it is the biggest issue when individuals who have a platform, namely celebrities, who are talking about medical information, making comments about medical advice that is based on either their own personal unique experience and or just their own non-medical opinion. That is a huge risk, and it is where we see, especially when it detracts and curbs public health initiatives like vaccine uptake, that it is a very ugly and scary situation. Now, where the opportunity is for almost everybody that is participating and listening today is that as researchers, as healthcare professionals, you are a credible voice, and your information is needed. And so you should be looking at every platform possible to actually disseminate and make sure that correct, researched, resourced information is being provided so that it is, in fact, educating and empowering individuals with better health outcomes. Another example of ugly, nasty, despicable social media communication is when individuals capitalize on the misfortunes of others and try to actually use social media to defend or make money off those efforts. And so we've obviously seen there's been significant media attention surrounding pricing and some individuals trying to defend those efforts in a very unethical manner. Also, when there are chronic illnesses, disease outbreaks, to see individuals wanting to sell things like sexyable nursing costumes, it's just obviously in very poor taste and does lead to very ugly online situations. So that's my presentation, and I welcome any questions that you might have.
All right, thanks again. Another great presentation and some really great examples of the good and the bad and the ugly. We do have a few questions come in. We have about 10 minutes left to take some of these questions. So one of the questions that came in, and I think a lot of people will have this question, and anyone feel free to jump in, but we'll start with you, Rob. You mentioned about how it's not all about the numbers of followers, a lot of these campaigns, and in judging their success, and how we should be more focused on engagement. How do you measure engagement, or what does successful engagement look like?
Yeah, it's a great, it's really evolved in terms of how we measure the success and evaluate information dissemination online. I mean, I know, and I guess really another example within my industry is when we would look at, media impressions, or when the Globe and Mail or the CBC or CTV was reporting on an announcement that you were making, you would see the number of viewers that, or listeners or watchers that would typically tune into those newscasts and look at those numbers and think that was a really great, successful campaign. But again, we take a deeper step back and look at who our audience is and what we're trying to communicate. And so if we are trying to engage, for instance, an older seniors demographic with some type of message, and we don't, engage outlets like Zoomer Magazine or Zoomer Radio, then it's really a miss because we haven't engaged that audience. Same thing with in an online aspect. If you are trying to communicate to a pediatric health message, I really do believe that mommy bloggers are just so really important. And if you're engaging online mom advocates who have a dedicated following and they're disseminating your message and adding further commentary and support to that message, that is far more valuable than getting write-ups in either Teen Beat or other obscure publications that just aren't going to resonate with your audience. So it is more about looking at the audience that you're trying to engage and make sure that you are actually successfully communicating with them in a meaningful manner.
And do you have any thoughts about how you determined whether your social media engagements have been successful, whether it's a program at GEO or in getting information out about research here?
Yeah, I would say that the numbers themselves are only part of the story. So if you look at, for instance, the one Facebook post on vaccines, which generated 25,000 views and 2,000 likes and comments, which is a great big number, but did that influence any different action? Did any more people get the vaccine than they would have otherwise? We don't know that because we can't track that through. So while 25,000 is a decent number compared to, for instance, Dr. Doja's video on tics and Tourette's has 350 views, small number of views for a YouTube video, but by key people who were supposed to see the video, so patients whose doctors wanted them to get a referral to that clinic. So those patients saw that video, and it must have been a successful educational interaction in that they've got enough information that the doctors didn't feel the need to resubmit it. So the numbers itself to me is only very partially relevant. So let's say that Dr. Benchimol ends up doing an online community for IBD patients, and let's say that only 50 patients sign up for it. It might seem like a small number of people in that community, but if those patients end up having better health outcomes because through a peer support network they better adhere to their medication and they better adhere to their diet and other things like that, and if that produces a better health outcome, then it's almost irrelevant how many people are a member of that community. So I think that what we need to have to do is to figure out very specific actions that we want to come out of the social media and figure out how to track those, and that's where it gets tricky, but that's where it gets so cool.
Yeah.
Thanks, and yeah, no, I totally agree. I think really it's engagement and outcomes that are measurable that are most important when you're engaging in this type of activity. One quick note that for researchers, there was actually, in past universities and hospitals would measure productivity in research basically on the number of publications you have and the number of citations each publication has, and that was and the number of grants and things like that. More recently, they've come out with something called the Altmetrics score. And if you Google Altmetrics, Altmetrics, you'll see that it's a score where basically they will rank the article based on social media engagement. So number of tweets, number of responses, number of media hits, number of Facebook posts. And so scientists are actually able to measure how widely their research is being disseminated beyond other scientists and in the social media sphere. So I think, researchers are getting engaged in trying to figure this out and trying to measure the output.
Yeah, no, it's a great question as far as how you demonstrate the effectiveness and the engagement, et cetera, especially when you're relying on that information to perhaps get funders. I mean, we experience that all the time. When we have a session like this might be the kind of session we have at our annual conference in which we might have 50, 100 people at a concurrent session that attend that. And that seems like a lot. And if we have, say, 300 or 400 people attend this webinar or 1,000 people attend it live versus in addition to watching it online, when you compare that to other videos on YouTube that are getting 1 million, it all of a sudden doesn't look like much, but it might be as much as 10 times what we would get at an in-person conference. But when funders are looking at that, they look at those numbers in comparison to other things that are on that social media space, like that are getting millions of views, and they say, well, geez, it doesn't look like much. But when you put it into context, it's actually quite a large number based on your audience and the having the right people seeing that information. So it really is a challenging issue. And we did have a question come in about Dr. Doja's video about the Tourette's and tics. The person has suggested that that seems like more of a traditional media rather than social media because there's no comments on the video, etc. Is that video or that approach are you looking at expanding that to become more social as a next phase, so where you would have more engagement in addition to just sharing the video?
So I agree. It's the age-old debate about what is social media. Is it the YouTubes and even apps? So, Rob and I think Eric too provided examples of cool apps, and apps by nature aren't usually social, although they can be. So I'm with you. I've always debated that myself. Are we looking at making that particular video more social? Could be. Actually, I can talk to Dr. Doja about it. I didn't realize we didn't have comments turned on to it. And we've had other clinicians who have approached me about looking at trying to do online communities where there is both the trusted sources of information, if you will, i.e. like a video like Dr. Doja's, but as well as some element of peer support where also a nurse might interact periodically with that community online. I think that's where a really interesting opportunity is, but it takes resources and nurses, for instance, from a program, be it oncology or another program, who can commit the time to it. But that's where I think the next really interesting opportunity is to embed those things together, where you can provide some of that kind of trusted source of information in a community forum where you see the reliable information, i.e. the video, but also an opportunity to engage with them. But we're not there yet. We've had discussions on it, but there's a lot of, as Dr. Benchimol pointed out before, privacy issues to sort through, and how do you make sure that information gets captured later in the patient record, because it can't exist just on the social media forum. You want to make sure that that information is tracked. So how do you do that? So there's those things that still have to be worked out.
Asking the question, he said it seems like it's a social package that needs to be pursued from multiple angles, and I think we often sort of talk about social media sort of in its, or anything that happens online, as separate from the rest of life. I mean, this is about a video that's actually tied in with the physical interaction of the patient and the referring physician. So it sort of supplements that in-person conversation to give them information in lieu of immediately seeing the specialist, but looking at it as part of all of the communications, both in person, online, social, etc.
Yeah, and I do find it interesting how, for some bizarre reason, our videos on YouTube get more views than our videos embedded in our website.
Yeah, that is interesting. We do have, I think maybe it's the question of the hour here. Ashley's asking, and this is, again, maybe we'll get it from each of your perspectives that you can have on this. Maybe starting with you, Anne. She's asking, what would be your best piece of advice for a small healthcare facility that works with children and is interested in getting into social media, but you don't have a budget to hire a communications person? And I think we're talking anything from small community hospitals to even smaller children's treatment centers or rehab centers, or those small agencies that want to get out there, but really don't have the budget to hire a person to take care of it. So, Anne, maybe we'll start with you.
I guess it's start small and pragmatically and grow from there. And also, it really doesn't need to be communicators, particularly in health, because there are champions in any hospital. So Dr. Benchimol is a great example of that. So, a physician who actively, he not only does his own Twitter account, but he also does the GOIBD account. And there's others like that in any organization who just are more, if you will, social by nature, who want to find those solutions. So it's maybe working with those people to figure out what pilots can we run, and it doesn't have to be a commitment forever, but you run the pilot, you see if they get benefit out of it. Once they see they get benefit of it, then you can expand it. And also, on a side note, CHEO relies heavily on the use of volunteers to support some of our more traditional hospital foundation type of social media interaction, so that's always an opportunity for a small or mid-sized hospital too.
And Eric, how about you? You're from the perspective of a somewhat large research institute, but what about the researcher that's maybe got a small lab at a university that wants to get online and start being more social?
Well, I think the rule is sort of the same. Is you got to identify social media champions who maybe are already knowledgeable and already involved, or maybe not, but are just interested. So I think a lab, a lot of the time, that's going to be the grad students, right? That's going to be the either technicians or grad students who might be a little bit younger and more engaged and know how to use it. And if you can, engage those social media champions and build on their followers and help shape what they tweet about in terms of the knowledge, I think that's the way to start out. I think, most of the labs that I'm aware of, usually it's the grad students that are doing the tweeting and not necessarily the principal investigator. But I think that will eventually change as the age of the principal or the birth year of the principal investigator on average goes up. So I think, I think things are changing, but grad students are a great resource.
All right. And Rob, your thoughts? Like, where would you say people start, especially those small organizations that don't have a lot of the resources?
Well, I completely agree with the comments that were made to start small, walk before you run, use pilots and test, and also Dr. Benchimol has a great point. I mean, you don't need to necessarily invest time in building something if you've already got colleagues that are within the hospital that are already great advocates and they want to do this, you should really get behind and champion and support their efforts. But I think that if the question is coming from a hospital that has absolutely zero social media and they are looking to get started, Facebook is the most used social media platform in our country, and so it is a good starting point. And so I think that you just, as I noted earlier, just go through before you do anything. Ask yourself why you're doing this. Ask yourself who you're wanting to communicate with, and invest a little bit of time and thought before you launch, because that will be much more effective. And you don't have to. I mean, obviously, you can invest a lot of resources and time and energy into social media, but you don't have to. I mean, there are plenty of organizations that very successfully have either a Facebook page or a Twitter account, and they're putting out, one or two posts a day, but they're really, really meaningful, high visual, high engaging posts that are relevant, providing useful either information or utility to their audience, and so that they're in demand. And so you don't have to be posting on your Facebook page every minute, and you don't have to be putting out multiple tweets in a day. So just triage your needs and walk before you run.
All right, and Ashley just posted a comment. She says that's very, very helpful tips, and I'll give you another one, Ashley. I mean, there's an organization called Quinte Pediatrics that's Quinte Pediatrics and Adolescent Medicine, and I believe they're in Belleville, Ontario, small center, not too far from Ottawa, and they make extensive use of social media and have for quite a number of years, and they came out to our conference and presented on that quite a few years ago. I think it was the year after we had Anne at the conference in Ottawa, and they are very much an organization that saw the benefits early on of social media. They're very small, not a lot of resources, and they just bit the bullet and started using it because they could really see that there was potentially a lot of benefit, and I think they saw a lot of success with that. Dr. Paul Dempsey is the lead physician there. His Twitter handle is Dr. Paul Dempsey, all one word, or at Quinte Pediatric or at Quinte Health are some of their other Twitter handles. And I certainly encourage you to reach out to them and see what they did or get some examples from them, because they really, as a small organization, they really maximized what they were able to do with social media. All right, so I think we're out of time. I think this might be a good place to wrap up. So I'll just say thanks to our panel. I mean, it really was a great discussion. I think we got we really highlighted what the good, the bad, and the ugly were, and some great next steps for the small organizations, some great tools and things to watch out for the other organizations. But I think overall the message is you've got to find the place where you're going to find value in using the social media, and just do it and be prepared and engage in the conversation. So great presentation again, so thank you very much to our presenters. And thank you to the audience for joining us today. We do our webinars every Wednesday at 11 a.m. Eastern Time. And it's always great when you can watch live, because you can participate in the discussion, as you can see today. But when you can't, we do record the sessions and make them available after the fact on the Knowledge Exchange Network. Next week, we'll be hearing from some work that's been led by our colleagues at the Canadian Pediatric Society, where we'll hear about promoting early literacy in health settings, connecting for a national strategy. And we'll be hearing from Dr. Alison Shaw, Carol McDougall, and Jan LaRiviere, who will show us that learning to read starts at birth, and they will explore why and how we can support early literacy in the hospitals and other healthcare settings. And then following that, on April 27th, we'll be partnering with Immunize Canada. Lots of talk today about the vaccinations and the anti-vax message, but we'll be partnering with Immunize Canada to bring immunization beyond coverage monitoring and the role for pediatric health centers. And we'll hear from Nicolas Gilbert from the Public Health Agency of Canada, and Dr. Marina Salvadori from the Children's Hospital at London Health Sciences in London, Ontario. And they'll be talking about the 2013 Childhood National Immunization Coverage Survey, which is going to give us a real sense of what the state of the union is as far as immunization in Canada. And from there, we'll be hearing from a hospital, from Dr. Salvadori, from the hospital perspective, as why our pediatric health centers should be taking more of a leadership role in immunization, particularly as it relates to children with disabilities and medically complex children, as well as healthcare providers and the importance of immunization to those populations. So some great stuff coming up in the next couple of weeks. Thanks again for joining us today. and we hope to see you back here next week. Bye, everyone.